When people hear the word radiation, they often have a lot of questions and sometimes a few misconceptions.
Welcome to What Brings You In Today, a podcast by SGMC Health.
I'm Kara Hope Brockwell.
And I'm Erica Bennett, and today we're here with Paul Adedoyin, MD, a radiation oncologist here at our Pearlman Cancer Center. So, Dr. Adedoyin, what brings you in today?
Thank you for having me. I'm here to talk about radiation oncology and everything that's involved in it.
Very good. Well, let's just start it off by just giving us a little background, maybe about your education, how you got here, what inspired you to take this career journey.
Absolutely. So I started my undergrad education at Florida Atlantic University in Boca Raton in Florida. Mm-hmm. I majored in chemistry. After I graduated, I took a 2-year gap before going to medical school at University of Central Florida in Orlando. Mm-hmm. I stayed there for an additional year after graduating from my intern year before then relocating to Brooklyn, New York City for the radiation oncology residency program. Mm-hmm. I finished that program in 2021, right in the middle of COVID, mm-hmm. and then took my first job at West Virginia with Marshall University, where I was on faculty for 3 years before relocating to South Georgia.
Yeah, you moved around a lot.
Yes. That's been, the highlights of my career in education. Just growing up, we've always moved from one place to another. Yeah. I can't count how many times I've moved.
So what do you think about Valdosta since you've been here for a few years now?
It's a very warm community. I've enjoyed my time here. The people are very nice, just very collegiate in terms of working together to provide the best care for our patients.
What made you decide to go into radiation oncology?
Yeah, I get that question quite a lot because, and it's such a unique field. Mm-hmm. It's not something that we are exposed to in medical school. But for me, I was lucky to go to University of Central Florida, where you're exposed to research program at such an early, like between your first and second year, and we were given a list of research topics that we could participate in as a medical student. And one of the research topics was about using immunotherapy for brain metastases that are spread from melanoma. Mm. And it was a topic that I find quite interesting at the time. I was, this is very interesting. So I reached out to the physician that was that was in charge of that research. And he happened to be a radiation oncologist. Mm-hmm. So when I met with him, we talked about my interest in the research, and then he asked me, said, "What do you know about radiation oncology?" I said, flat out, nothing. Yeah. You're the first radiation oncology I've ever met, and that's how the interest started, because I had to shadow him and work with him closely in the clinic and also on that research.
So for those that don't know, as you said, you didn't really know anything about radiation therapy when you spoke with him. I'm sure many of our listeners don't know what it is either. So what's the simplest way of explaining what radiation oncology is, or radiation therapy? I'm sure it may be used in things other than oncology, but... Yes,
no, that's a good question. First and foremost, radiation oncology is an oncologist that specializes in using high energy X-ray, targeting, cancers, working in collaboration with our medical oncologists and surgical oncologists to provide and optimize cancer care for our patients.
What is radiation, though? Like, how do you explain radiation in general?
Therapeutic radiation is a targeted high-energy X-ray. That's basically what it is. Mm-hmm. It's a targeted X-ray that we use, in the form of proton, heavy ions, or just, regular old X-rays.
Okay.
Yeah.
I mean, I don't know how it works. I just know I've seen X-rays, and you get radiation, exposure to radiation when you're having an X-ray. But it's kind of baffling how all of that even came about, and it's evolved and is used to treat patients. I mean, it's fascinating.
Correct. And you're not the only one. It's a very common question that we get from the patient. I guess one of the most misconceptions is just folks think that their whole body are going to be exposed to radiation. Mm-hmm. It's just only the part of the cancer, because it's highly targeted. Mm-hmm. It's hardly, because we get questions like, will my hair fall off? If we're treating your breast, for instance, or if we're treating your prostate, will my hair fall off? Mm-hmm. And the answer is no, it's not going to fall off, because it's very targeted, and we're only treating where the cancer is. So it won't affect parts of your body that are not being exposed to radiation.
Yeah. So I've been able to see some of when we do tours throughout the cancer center, and they'll show like how they build like cast and things to keep your body exactly still, and so that you are only treating that very, very specific part, and that you don't move. And I mean, that's amazing, like the technology that you can use to make sure that you're accurate in that way.
Yes, we use quite a bit of technology in the field, and technology has come a long way. One example that I use with my patient is just looking at your regular appliances at home. Your TV 30 years ago is not the same TV that we have nowadays.
That's right.
So you can imagine with the same technology we have in radiation and delivering, it has changed quite a bit. So even just speaking to what you were talking about, the cast, and that's just one part of the treatment, is what we call the immobilization, to make sure that we can immobilize that part of the body that we're trying to target, and so that we can rely on the consistent positioning for the daily treatment of radiation.
What types of cancers are most commonly treated with radiation here at the Pearlman Cancer Center?
That's a good question. So we treat variety of cancers. I would say the two most common would be prostate and breast. Mm-hmm. We also treat head and neck cancers. We treat GYN cancers as well. But prostate is a very common cancer that we treat with radiation. Mm-hmm. Some patients are eligible for surgery, and in those cases, they go right to surgery. And if there are any indication for additional treatment, radiation may be part of that equation. Mm-hmm. And for patients that are a little bit older, that are not candidate for surgery for different reasons, including their age or medical comorbidities, radiation definitely is the mainstay for those folks.
Does it have less side effects than like chemotherapy? I mean, well, obviously, I'm sure it does, but what are the side effects, I guess, of radiation therapy?
That's a good question. So side effect, the way we think of radiation side effects are mainly dictated by the parts of the body that we're treating. Gotcha. Mm-hmm. Yeah. But to your questions, I do say for the most part, radiation side effects are less severe than chemo side effect, because chemo is typically systemic. When it's given, it's intravenously. So wherever you have blood supplies,
it's going all over.
It's going all over. Whereas radiation is only going to target where we point the machine. Mm-hmm. So for radiation side effect, if you're treating prostate, the organs around the prostate, such as the bladder and the rectum, those are the two organs that we typically counsel patients on what to expect, such as increased urinary frequency or increased bowel movement, with the rectum. So it just kind of depends on what part of the body that we're targeting with the radiation.
Mm-hmm. And for radiation therapy, how long does that? I'm sure it's patient to patient, but like, how many times would someone might have to go through radiation therapy, and then how long of a period could it be? Minimum to maximum.
Right. In terms of the length, it depends on the dose, and this is where the radiation oncology expertise comes in. We decide, we calculate the dose that we need to cure the patient, to get rid of the cancer. Mm-hmm. And the dose can be given in a very small increment. It's the same amount every day, or it could be a bigger dose per fraction. Fraction is just the treatment. So we say, let's say 2 gray per fraction. That would be the conventional amount of radiation that they're getting per day. Versus if we give like 7 gray per fraction, that's a little bigger dose. And in those cases where we're giving a bigger dose of radiation, patient only require anywhere from 3 to 5 treatments. For their course of treatment.
Yeah.
So they finish in a shorter period of time. Versus if they're getting a smaller dose per fraction, they may require anywhere from 5 to 7 weeks course of radiation, or even longer in the case of prostate cancer.
So that's what y'all do. Y'all look at the cancer, and then you determine what the dose and treatment would be based on that and based on the patient.
Correct. It's quite individualized in the sense of depending on the type of cancer, the histology, what other treatment the patient have had before, what are the organs around the target. That goes into the amount of radiation that the patient can receive as well.
I know it is.
Really smart.
We recently introduced new treatment options for patients with prostate cancer. Can you talk a little bit about that?
Sure, absolutely. This is a new type of radiation in a class of its own, called radiopharmaceuticals. These are radioisotope, some form of treatment that we offer patients that are castrate resistant. In the sense that their prostate cancer have stopped responding to the hormone therapy, and it's no longer basically showing signs that the cancers are regressing. So instead of just sort of giving up, we have this other option of using Pluvicto. Pluvicto is one of the newest radiopharmaceutical in the market that has been FDA approved for this group of patients. And what this treatment does is it targets all prostate cancers, in the body that has this protein, the PSMA protein, and delivers radiation to those cells. It's a very unique and interesting way of delivering radiation than the conventional way of how we do it, delivering radiation from externally from the machine. This one is actually intravenously given, and the radioisotope just kind of go specifically to where the cancer is, which is quite unique.
That's fascinating.
Yeah, I mean, so cancer has obviously evolved tremendously, just like with any technology and medical advancements. What do you say to patients that are diagnosed with cancer now? I mean, I know it used to be like this big word that everyone was, it was like a death sentence, right? You felt like cancer, it's this big. But I feel like I'm around it much more working in the ER right next door. But I hear so many positive things, so many good outcomes now that we have such, a comprehensive team here in our cancer center.
Yes.
Maybe just speak to, if someone is diagnosed with cancer and they do decide to have treatment or consult with the Pearlman Cancer Center, what can they expect?
Of course. Well, the first thing I tell patients is there's nothing you did or you didn't do that caused the cancer. Cancer happens in, almost, does not discriminate. Cancer does not discriminate. We've seen cancer in healthy people and, less than ideal situation as well. Mm-hmm. So that's the first thing I tell patients, don't beat yourself up regarding this new diagnosis. Yeah. I mean, sometimes it could be, a form of a blessing in the sense that it means that you've lived long enough.
Yeah.
If sometimes, because if you live long enough, if you don't die of some sort of cardiovascular or stroke, it might be cancer.
Especially these days, I feel like with cancer on the rise. I mean, just from the.
Right.
But of course, we are seeing cancer in younger folks as well. Yeah. And the same thing goes with them as well. There's nothing you've done or you didn't do that caused this. It's just It's just a random event that is bound to happen. So, when patient comes in for a consultation, they're a lot of the time they're very anxious.
Yes.
And understandably so, correct, because they're walking into the department knowing that they will be talking to a radiation oncology. A lot of time they think they will be receiving their first round of radiation that day, but we quickly reassure them this is just a consultation. We're just talking today. It takes a lot to get everything ready, but it's a team effort, starting from the front desk staff to our nursing staff, to the therapist. We all do a unique job of trying to reassure the patient that everyone is working as a group, as a team. But it involves talking to them about their diagnosis, what the stage of the cancer is, which dictates the treatments that we offer, and what to expect when they come for the daily treatment, day to day, and week by week as well, and subsequently how we follow them, how we manage, and what is considered success in terms of their cancer treatment.
Well, now that you've been in your career, in your field for several years now, what do you love most about your job?
I would say, without a shadow of doubt, it's the patient. The patient definitely makes the day-to-day grind worth it. Being given the opportunity to treat patients with cancer, it's nothing short of a calling. So I think the patient definitely, just as much as the patient comes to learn about radiation, I learn a lot from my patients. Lessons of resilience, courage, being brave in the face of cancer diagnosis. So I would say patients, is definitely something that I love the most.
We do patient testimonials a lot in our department where we'll interview those patients. And, I mean, you're right. And you see it every day. We get to see it when we just get the opportunity to talk to some of those. But those are the strongest people alive, and they're so inspiring. And then that goes to, impact so many of them around them and communities even. It's just an interesting dynamic because it is a challenging and hard time. But through that, you grow and get stronger. And it's just an interesting field, that.
I know. It makes me cry usually writing those. It's sad, but it's also very, very inspiring.
Yes, very inspiring, very inspiring. Especially, the success story it gives you the strength to wake up the next day to keep going. Because if the patient can face the diagnosis, show up for the treatment, the staff, us included, the physician, we have no excuse.
Yeah, absolutely. Early detection plays a major role in the outcome of your cancer. So what are some screenings or warning signs that people can look out for when it comes to cancer prevention and early diagnosis?
Absolutely. Early detection, it's a big big component of cancer care. And that's what I tell patients all the time. The difference between stage 1 and stage 4 is just time. It's time. That's all it is. And time, is what helps the patients to be diagnosed early on, and checking with your primary care doctor, going for your routine screenings with mammograms, with PSAs. Those goes a long way. Yeah. Absolutely.
I think about, are there signs? I mean, I know that there are signs and symptoms, but I feel like people probably put off going because they fear that they're going to find something and then have to undergo this big treatment and stuff. But how would you encourage people to not let that fear keep them from, getting the help that they need?
No, I think that it's very common, and you said it. It's the fear of the unknown, the fear of that word cancer. But a lot of time it's just something else. Yeah, it's just something else. But knowing that the healthcare professionals are there for you to get to the bottom of whatever symptoms you may be having. I think does help. And also too, knowing that their treatment for their cure for some of these cancers, a lot of cancers are not death sentence.
Right.
So I think it's a lot easier to seek out care if you know that this can be resolved.
Yeah.
It's when you think, if I get cancer, oh my God, there's nothing they can do.
Yeah.
Right.
I'm just gonna slowly die. I think that plays a huge role in people avoiding seeking care.
Yeah.
But when you know that we've come a long way in healthcare, in research, in caring for cancer patients, I think that helps reassure patients that even if this is cancer, hopefully it's stage 1. We can take care of it, and maybe all you need is just surgery.
Right.
And that's the other aspect of cancer care, is that when it's diagnosed early, you may only need one form of treatment, and that's it. Versus if it's diagnosed at a later stage, like stage 3, that may require 3 different modality, surgery, chemo, and radiation, things like that.
Yeah, it's very dynamic.
Correct.
Cancer care, right?
Oh, absolutely.
I mean, there's so many different ways that you can approach things, and you work together with the medical oncologists, the surgeons, and the healthcare providers in the cancer center. Y'all collaborate to.
Yes, 100%. When we have cases that are not conventional or straightforward, we definitely have a meeting every week called Tumor Board. This is where we present cases that we need the opinion of our colleagues, and it's reassuring for the patient also to know that the case is being discussed in a collaborative manner, and everyone is kind of having an input, or making a recommendation on the best course of action on how to approach it, as opposed to unilaterally making those decisions. Because cancer care can be very complex. So having our medical oncology colleagues and surgical oncology colleagues in providing us with their expertise in caring for these patients, goes a long way.
Yeah.
That would make me feel better to know that I had 3 or 4 doctors discussing my
Right.
case rather than just one.
Yes.
Absolutely. It's a team effort.
Absolutely. Yeah.
Are there any lifestyle habits or risk reduction strategies that people can adopt to lower their chances of developing cancer?
Yeah, there are some, with the caveat that even doing all those things doesn't guarantee that cancer may not still develop.
Sure.
Because we see patients that have the utmost healthiest lifestyle. They've never smoked, they've never drank, and still develop cancers.
Right.
So sometimes it's just genetics as well, but. Some of the lifestyle changes that I think most people are aware of is, the biggest, I would say, is, smoking and drinking. Those are, I would say, the 2 biggest ones. The other ones that, I may add would be avoiding, processed meat as well, just the way those food are processed, and also, goes a long way.
You may or may not know the answer to this, so I'm just throwing this out here randomly. But, you mentioned smoking and drinking. And smoking, it has the Surgeon General's warning or whatever on it. It's well known that it can result in cancer. Alcohol, on the other hand, is much more promoted, as a lifestyle. People have a glass of wine and relax or whatever. It's less connected to the cancer. I mean, you're not seeing those warnings on there. I don't feel like as frequently. I am seeing a lot more messages about it now. But why is that with the alcohol?
I think the shortest answer is just cultural. It's just our cultural, disposition to alcohol. And, I think that's what it is.
I mean, it's promoted as like fun.
Yes.
It's the same way cigarettes were back when they first
Right.
came out.
Yes.
I mean, it's just interesting that that hasn't like turned completely yet. I think as a society we're kind of getting there.
Yes.
I see more messages about like limiting or avoiding. I think they even did change it recently to
Yes.
where, because for a while it was like a glass a day was okay,
Right.
and now they're like.
Right, there's no any safe amount. Correct.
Right.
Correct. And alcohol has always been listed on WHO carcinogen. It's always been listed there. It's just we're just catching up to their standard.
Yeah.
Actually, it's
Yeah.
been there on their list as level 1 carcinogen. But I think it's because it's promoted. It's something that we it's part of our culture. You
Right.
know, when we watch sports, it's there.
Yes,
when we
everywhere.
celebrate,
It's
there.
everywhere. So it's just interesting that it's such a difference between the alcohol and the cigarettes as far
Right.
as a societal
Right.
marketing.
Right, and then there's this idea of the amount, the threshold. Okay, maybe one glass is enough. I mean, it's fine. Or drinking too much might be where you cross the threshold. But we really don't know, and the less the better. I think that's the message.
Yeah. And it's like one of those things where it seemed like growing up that maybe we were going to be the generation to end smoking, and then vapes started rising in popularity. I feel like they just adapt to make it appealing again so that young people will start doing it.
Yes. No, unfortunately, that's, like you said, it seems like that was going to be gone for good, but, they find a way, technology.
I know.
I mean, it's interesting. Well, I know we're about to wrap up here in a second, but I did want to ask, how are your kids? Because you have 2 kids.
Yes.
And how old are they now?
They're 1 and 4-year-old.
Okay.
Yes.
Boys? Or
One
boy,
girl. The
Okay.
1-year-old she's is a girl, and the
Okay.
4-year-old is a boy.
Okay. I think last time I talked to you, maybe you just found out you're expecting your girl. Or
Yes.
something, so.
Yes.
How are they? They're good and
They're
wild?
good. Yes.
Okay.
Yes. The usual stuff. Kids, right?
That's fun. That's fun.
Looking toward the future, are there any exciting developments in radiation oncology or cancer care that you're excited about?
Yeah, one of which is we've discussed the radiopharmaceuticals. There's a lot in the pipeline for different cancers, because the one we talked about was for prostate cancers in the metastatic castration-resistant settings. But there are other radioisotopes in the pipeline that are being developed for other types of cancers that I'm very excited about.
Yeah, who knows what will be
Yeah,
5
even
to 10
5,
years
10
from
years,
now.
absolutely.
Things
the way
change.
it's going. Yeah,
Yes,
it's crazy.
you know.
But that's such good news. I mean,
It's great for South Georgia and North Florida.
Absolutely,
To
yeah.
have the Pearlman Cancer Center to count on.
Definitely.
yeah. Well, we thank you for joining us today,
Okay.
getting an update on everything you've been doing here at the Cancer Center, and
Absolutely.
we appreciate your service. And
Thank you for having me. It's been fun.
all right.
And don't forget to like and subscribe, and you can submit any questions that you might have for future podcasts at sgmc.org/podcast. See you next time.